Hey you guys, so I wanted to come back and give you guys a little more insight on my symptoms and the things that I've been going through, as well as my diet. So I finished my triple treatment a week ago, and of course I'm still dealing with symptoms. I still deal with headaches, terry stools, stomach pain. You know, in the beginning it was very rough because once I started the triple treatment, the symptoms to me got worse. So if you're starting a triple treatment, it's gonna get worse before it gets better. You'll eventually start feeling back to yourself, but you're still gonna have those symptoms. The triple treatment did me really, it did me in. I was on amoxicillin, clarithromycin, and omeprazole, which is the acid reducer. And once I still take Tums every day. Well, I do like up to 4 you can do up to 6, but depending on my meal size and what I'm eating, I take 2 before or after my meal, especially if I feel that feeling coming on. So Memorial Day weekend is when all my symptoms started. I've talked to people that have dealt with this thing for like months and months and months before they ever had an answer. And mine has been going on for almost 4 weeks now. So I can't imagine someone that's been dealing with it longer than that. So it started out with the intense chest pain. It was like a numb feeling up my arm, almost like a heart attack feeling. I thought I was out of here. So I went to the emergency room multiple times. Every day was a different symptom. It was the burning in my chest, the bad traveling headache, stomach pain. My joints were hurting, loss of appetite. I've even lost 20 pounds since this thing has been taken over. Excuse my children. Um, I lost my train of thought. But a lot of it is what you eat, what you're eating. And I had to realize that because, you can watch so many videos and then you realize, okay, well, this is treating me worse. I feel bad after I consume this, or, so just really pay attention to what you're eating. So a lot of days I eat a baked potato, no butter, no salt, because I don't want to feel that feeling after I'm done with my meal. Chick-fil-A chicken nuggets, I'll put some of that over it. I'll saute some vegetables and put that over my potato. Like, I eat different variations of a potato, but that's essentially what I'm eating. I drink protein shakes in the mornings and at night if I can. Bananas, things that are gonna give you good nutrients. That's the things you need to be consuming. Avocados, good bacteria is what you need to be consuming so it can fight it, so it can help get rid of the H. pylori. So I have a cousin that has GERD, and he dealt with a lot of what I'm going through. And so a lot of times when I do have a flare up or a episode, I call him, and he's kind of my calm in the storm, because if it had not been for him, honestly, I probably would have went to the hospital multiple more times and had another bill, had more bills multiple more times. So had it not been for him, then it could have been worse for me, because this thing has really changed a lot. In the past 4 weeks, it has changed a lot of my life. So with changing my diet, I can't eat like a lot of acidic foods anymore. It tears me up. Tomatoes, I was really never able to eat red foods, but now more than anything, I can't. If it has tomato in it, if it's cooked into it, I cannot eat it. If it's too greasy, I can't eat it. If it's too seasoned, don't eat it. Buttery, don't eat it. I cook with grapeseed oil now, so that has been helping me out a lot. I'm actually And this is another thing. My regular physician focused more so on my mental health, which is fine. Thanks. Thank you for that. But in the end, it leaves me feeling like, okay, you're not worried about what's actually going on with me. You're so focused on my mental health. You're not worrying about the other symptoms I'm having. You're not, because essentially the ER, they're the ones that tested me for Hpylori. They're the ones that prescribed me the triple treatment, all that. My doctor had nothing to do with that. I went and seen her a week after I was prescribed the triple treatment, and her thing was, oh well, I'm gonna give you some anxiety medicine. No, can we treat this thing first? Can we get rid of this first before you start giving me anxiety medicine? I just thought that was so crazy. Like, why can't I get rid of this first before you treat that? It makes your anxiety times 10 because you go into panic mode because you have so much going on with your body. I hate being alone. I hate being alone. Now, I used to love my solitude. Love it. Now, I have to have, if I feel that feeling, it's like I either want my fiance around or I want my mom around. Like, he's on the road a lot because he drives trucks. So, of course, I can't have him, when I get that feeling. So I'll pack me and my kids up, and it's so sad. It is so sad. I'll pack me and my kids up, and I'll go to my mom's house. And I try so badly not to cry because of how much this thing has changed me. It has really, the blurred vision, the sensitivity to light. Like, guys, this thing, it has so many different, it takes your body through so many different things. And it's almost like, it hurts my feelings to know that this disgusting thing is inside of me. And it's like, it's making me feel the way I'm feeling. And the thing is, like, a lot of professionals have no idea how serious it is. They give you the triple treatment and just, send you on your way. And it's like, they can't tell you that this is what you're going to deal with, or, it's going to happen like this, or it's going to get worse before. It's like everyone has different symptoms. Everyone's body is different. But I have felt every symptom there is to feel. Every symptom. And I need to start writing a list, like keeping a journal of the things that I go through daily, because I'm just trying to just do this video on a whim, like just do it as I go. But it's so much, it's so much. And I just wish, I'm not in any Facebook groups. I joined a Facebook group, and honestly, I wouldn't advise anyone to do that. Please don't do that, because that's going to make your anxiety worse. Just like Googling symptoms. That's what I started doing in the beginning. So it was really hard for me in the beginning because I was Googling stuff that was going on with my body, and the things that were coming up it's going to scare you more. And the thing with this thing is, you have to stay as calm as possible, because once you get your body worked up, your anxiety is going to go to 10, and then that's like, you're going to panic. So it's best to stay as calm as possible. Calm as possible. Because I'm just now getting to the point where I'm okay with being around a lot of people. I'm okay with going into a grocery store with a lot of people, because at first I could not do it. I felt like everything was closing in on me. So you have to stay calm. You have to. It's a mind thing. A lot of it is a mind thing. You have to stay calm. I was trying to answer as many questions as I could, because I had so many questions when it came to, when it came to Hpylori, and my doctors weren't able to answer a lot of the questions. My doctor wasn't able to answer a lot of the questions. It was kind of like, pass over what you have going on. Let's focus on your anxiety. Let's focus on your behavior. No. So, and the crazy part is my bariatric doctor, because I'm supposed to have weight loss surgery, you know, soon. He's trying to make sure that, you know, the H. pylori is gone and I'm okay. So he's the one that ordered for me to have an endoscopy. I think that's how you pronounce it, endoscopy. My regular doctor didn't. So it's just, you know, I feel like I need to seek a better doctor. I do, because I'm just, you know, if you have a doctor and you're not comfortable with, you know, the way that they do things, or if you don't feel comfortable when you go see them, if you're not comfortable when you leave your appointment, you need to change doctors. I know a lot of doctors are so overwhelmed with patients and all that stuff, but you still are paying your doctor. They're still getting paid. So, and most of us have good insurance, so it's no reason why we should feel like half full when we leave a doctor. So yeah, I just wanted to come on and, you know, just give a little update of what I have going on. I still deal with it's mostly the majority of my symptoms now is like the terry stool, headaches, and the joint pain, and stomach pain here and there, but it's not as bad as it was. But yeah, I still would deal with symptoms even after my triple therapy. So hopefully after this Thursday I'll have some more answers or something to give me a better vision of what's to happen or what's going on. So Thursday is my endoscopy, and I plan on doing a video after my endoscopy, or once I get my results, I'll come back and do another video or update. So thank you guys for watching. Stay strong, keep your head up if you're dealing with this. So I'll talk to you guys later.